Welcome to the Mindful Practice Podcast, a space for physicians navigating burnout, identity shifts, and career change without pressure or judgment. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, coach, and writer. Here we talk honestly about what it means to build a sustainable career and a life beyond medicine and survival. Episode 2. Burned Out is Not Broken. Understanding Physician Burnout. Welcome back to the Mindful Practice Podcast. I'm your host, Dr. Bertina Hooks. Today we're talking about burnout, not as a buzzword, but as a lived reality for physicians. As you listen, notice what your body does. Where do you tighten? Where do you sigh? Where something feels familiar? How your breathing is affected? How your heart rate changes? How you perceive your calling, medicine. Burnout is a healthcare crisis for physicians. More awareness was raised about burnout during the coronavirus pandemic. And with more awareness, there has been more initiatives to promote physician wellness. However, there still needs to be more awareness about physician burnout, and more physicians need to be helped in assessing if they have burnout and developing tools and strategies to overcome burnout. That's why this podcast exists, to help physicians identify if they are burned out, the degree of severity, and how to start the burnout recovery process. What burnout looks like. Burnout isn't just being tired. It shows up as emotional exhaustion, physical exhaustion, irritability, depersonalization, brain fog, dreading going to work. It often appears as competence on the outside, but depletion on the inside. Burnout does not mean you're failing. It means something in your environment is unsustainable. These signals are a sign for the need to change. Why physicians burn out? Physicians burn out because we're practicing in systems that reward self-abandonment, documentation, productivity pressure, lack of autonomy, moral injury. Burnout is what happens when your values and workplace are misaligned. Burnout is a deep and emotional and physical exhaustion from your work that contradicts your values, purpose, or identity. No amount of yoga can fix that. No amount of vacations can cure it. No amount of support alone can resolve it. When your job demands clash or conflict with your personal ethics or principles, when you find your work lacks meaning or impact, when your work is driven by productivity, money, or status instead of intrinsic motivation. This leads to a disconnect from yourself, and an identity crisis. There is a disconnection between your true self and your professional identity. The symptoms of burnout are emotional, behavioral, and physical. The emotional symptoms include dread, anxiety, numbness, cynicism, and feeling hollow and empty. The behavioral symptoms include apathy, reduced performance, and self-doubt. Physically, you start to experience chronic fatigue, digestive issues such as abdominal pain, nausea, vomiting, diarrhea, or headaches. All of these are symptoms of burnout, and knowing what the symptoms are and acknowledging that you're feeling those symptoms is the first step to recovery. Why rest is not enough. Many physicians take time off, vacations, sabbaticals, only to return more exhausted. Why does rest not work? Or why is rest not a cure for burnout? That's because burnout is not about fatigue. It's about misalignment. Rest and relaxation helps restore our tired bodies and minds. Alignment heals burned out ones. In order to determine if you have misalignment burnout, you need to identify what are your core values. And are these core values such as empathy, integrity, excellence, are these values in alignment with what you do in your daily work? Is your career aligned with your core values? And also, is those activities you do in your work either increasing your energy or depleting your energy? It is important to do an energy value audit in order to determine what matters most to you. And in doing so, you can realign your core values with your career. What actually helps burnout? Healing burnout requires more than rest, as I just mentioned. It requires setting and communicating boundaries, energy-based scheduling, identity beyond productivity, and support. These concepts are very important because a lot of physicians struggle with setting boundaries in their careers. Boundaries are very important in preventing burnout because they tell others how you want to be treated. However, a lot of physicians have difficulty identifying, communicating those boundaries in a clear, concise way without feeling guilt. Setting boundaries tells others how you want to be treated. And it helps you have downtime away from work. For example, you can set a boundary when you're on call that no unnecessary calls are given to you after a certain hour, such as 9 p.m. Or you can set a boundary where you don't answer emails after hours. You can do this in a very clear, concise, and polite manner. And by setting boundaries, we are telling people that our values, our worth matters. We cannot work all the time, and our roles as physicians cannot engulf us. We are more than our profession. In addition to setting and communicating boundaries, it's also important to do an audit where you look at energy depleting and energy energizing activities. So look at the things in your career that matter most to you. It could be research. It could be teaching residents and fellows. It could be clinical and direct patient care. It could be education. Once you define those activities that energize you and motivate you to practice medicine, you also need to do an audit of your values as well. And look at, do these values align with my current role? And if they don't, maybe I need to modify or do a career shift towards things that do align with my values. Your core values include things such as integrity, empathy. Those values really are what define who you are. In addition, a lot of physicians feel that their identity in the healthcare system is defined by their productivity. How many patients they see, how much money they make. And that is defined by how we are evaluated in doing our jobs as physicians. But our identity entails more than RVUs or charting. It entails taking care of patients and having a personal connection. Each encounter with patients can be emotionally and physically exhausting. And we are human beings and desire and deserve to have a career that sustains and fulfills us. Finally, peer support is very important. In addition to peer support, it's also important to have friends and family support or social support. It's also important to maybe have a therapist or coach who can support you in identifying your needs and values and aligning it with your career. That's where coaching, community, and systemic advocacy matter. Because we also need support from our administrators and the healthcare system itself. Remember that burnout is a systemic issue where the demands of healthcare are placed on the shoulders of physicians, asking us to see more patients, provide more care with limited resources. And our time is often divided with doing administrative tasks that are related to patient care, but do not make as much of an impact on patient care. In order to start the burnout recovery process, first, we have to identify the gap. Assess what values are being violated and not aligned with our current career roles. Once we've assessed those values, then we need to adjust our work or role to better fit those values. And this may involve making changes like time management or setting and communicating boundaries or it may require you to make a bigger career shift. And we'll be discussing those different career options in this podcast. Finally, you need to start to reflect and reconnect. Take time to unplug away from work and clarify what truly matters to you. And that process takes time. That is why peer support, coaching, and having clear, transparent conversations with administrators who advocate for patients really matters. I hope that this episode about burnout and starting the burnout recovery process resonated with you. I hope that I was able to provide some insight and value about what burnout is, what it is not, and how to start the process for burnout recovery. On the next episode, we will discuss more about burnout recovery and how coaching in particular can be an effective tool for burnout recovery, career clarity, and building resistance. Thank you for listening to the Mindful Practice Podcast. If today's episode resonated with you, you can find free burnout and career clarity resources at pinnaclebusinessacademy.org. And if this podcast supported you, please consider subscribing or sharing it with a colleague who might need it. Remember, you are more than your white coat. You are not broken, and you are allowed to evolve. Until next time, take care of yourself, not just your role.